Okay, so what we're doing today is I've been asked to show you what a workflow session is like for our clerks. This is a UBC workflow session that I'm doing. I'm doing the UBC mood disorder. So you can start recording, Sarah. Thank you. And what we're doing is we're giving you sort of a high level of this is what Citrix Cerner is, this is the buttons you push, and this is your workflow for the clinic. The reason we chose this clinic is it's actually a little bit more complex than just a regular one of. They have clinical appointments as well as recurring appointments. So as a scheduling clerk, there's a couple of different things that they would be using. If you guys can see my mouse here, they actually use the work queue monitor, they use PM Office, they use PowerChart, and then they use the scheduling appointment. So as users, what you guys are going to do is you can log on now, or you can do this at your own pace. The workbook that was sent out to you is for the mood disorders, and it has different scenarios that after we take this offline that you guys are going to want to go through and you guys can play with. If you break it, perfect, because you guys need to know how to fix things, right? So that's always a good thing. And then what I'm going to be doing is the workbook. I'm going to be going based on the flow of how scheduling and registration works, not necessarily in the scenarios point by point by point. So everything that I talk about is mentioned throughout the workbook. It just might not be the exact flow that the workbook. So you don't need to follow the workbook along with me. Okay. So one of the things that I sent off this morning is when you are going in here, you'll have a username and a password to get you into Citrix. And that one is the CST remote training. It's all the same password. And then once you're in here, everybody will get a unique username and password. And that's the one that I sent off this morning just to the people that I thought were attending. I will make sure that everybody has a username and a password. And the reason why is because that would be your username and password when you log on. Okay. So down here, I've already got some of my things open. The first module that we're going to look at is we're going to look at PowerChart. So you can see here that I've actually logged in and this is my username here. Up here would be my name as Kelly Semple-Burkowski if I was the user. When you open PowerChart, so what is PowerChart? If you actually look through this, it's got all sorts of different things in here. We've got our ambulatory organizer, we've got our referral management, our message center. It also has external links down over here on the right-hand side. Nothing is linked through right now because we are in a train environment. But if you were needing any of the Care Connect, the PACS, or the fast form, these links will be connected once the site goes live. Okay. We also have obviously down here the exit. This PM conversation actually takes us over to PM Office. We also have over here our scheduling appointment book. So it actually takes us to where we can actually schedule. So depending on your workflow as a clerk, this might be where you actually start, or you might have all of your modules open. You can see here down on the bottom, I actually have all 4 of my open. As a clerk, I probably would have them open. Okay, so I'm just going to do a high level of what the PowerChart organizer is. The ambulatory organizer, this is actually where you can come in and you can see as a clerk what my day is going to be. So if I have some referrals or if I have appointments that I need to book, I would have a list in here. With CST Cerner, it's the same as any sort of scheduling registration system, is I would have to set up my defaults. Every clerk, the CST Cerner site is lovely in the sense that I can set up my preferences and my workflow based on Kelly. Sarah can set up hers based on Sarah. So it's not a one size fits all with CST Cerner, which is actually a really nice fit for clerks. Okay, so again, referral management, there's nothing under here right now because, well, there might be actually. Yeah, there isn't. Depending on the workflow, sorry, a little stickle. Depending on the workflow and depending on the clinic, not everything up here will be used. And it also depends on the job type. This is actually also being used by clinical staff because this is basically an electronic record. So referral management isn't necessarily something that our clinic would use. Message Center, this is an internal messaging system that is used for any of the Cerner sites to be able to talk to Cerner sites. So right now, Richmond is not on Cerner, so we can't actually have an internal conversation with anybody at the Richmond Hospital, but VGH is. So when UBC goes live, VGH and UBC can actually internally talk. So it's a messaging system. And it's we don't go into a lot of detail on that because this isn't actually our portion that we train. But the really cool thing about the messaging center is over here we have a little proxy. So we all know that when we share email boxes or when we share different clinics, this actually allows the clerk to be able to forward off their clinic to someone else to be able to communicate, to be able to watch the communication and to be able to relay messages, which is really nice with the messaging center. So I don't have to do it through Outlook or email. I can do it internally within the Power Chart. Care Compass isn't something that we use really as a clerk. The multi-patient task list, this is going to be clinic specific, whether or not they're going to be looking at it. And it's not something that we're going to be looking at today, right? Patient list, this is generally more for a clinical staff. This is where a nurse might have, these are the patients that they're going to be looking at within their clinic today. Perioperative tracking, again, is not something that we're going to be using for our clinic. Neither is the tracking shelf. Requisition manager, this is actually a big printer. So what this is this actually could be used within our clinics. And what this is just different printing. So think of this as being a printer that I may need to action something. I might have a report that I need to do. So depending on the clinic, depending on the clerk, depending on the workflow, the requisition manager may or may not be used, but it's just kind of thinking of as a printer. Exit is exit, and I don't want to actually quit the application. PM Office, if I click on that, I actually have it open down here. It actually is going to be opening up our access management, right? So this is basically our registration management desktop, and I will go over that in detail when we get back over to that. Okay, so that's our PM Office. Communicate is another one of the communication. We aren't suggesting using that one. We're suggesting using the message center. This is the medical record request. So this is something that our clerks will not be using, but it could be that a unit clerk has a medical record request outside of health records. And that's what that's for. Our Discern reporting portal. This is, again, something our clerks would be using. And this, again, is reporting different, it's different reports. So depending on the clinic, you may or may not have, you've all heard of slates. So if somebody needed to print a slate or something like this, this is kind of where they would go and use this. Because this is a train environment, it may or may not act exactly how it is in live. But the great thing about this is, again, if I was printing this admitted patients with active every single time, I can click over here on favorites, and then it automatically comes up as my favorite. So I no longer have to search for it every day. So this is where me being Kelly as a clerk, I can set up my preferences. Okay, so I'm just going to close that. I don't need it anymore, but that's what that's for. Printing, this is the scheduling appointment book, which I already have open down here. And so if I was to click on that, it would open up my mood disorders bookshelf. And this is where I actually schedule the appointments from. Okay. And then charge viewer is nothing we use, and batch charge entry is nothing we use. And then down here, you can see these are external links based on the little globe. They don't go anywhere right now. Okay. So that's our power chart. And then I'm just going to kind of briefly go over, this is the scheduling appointment book. And what this is I would actually be setting up my preferences as Kelly. And one of the things that I really like is I can actually go in here into properties, and I can actually change the color if I wanted to, which is kind of cool. So now I'm purple today. We don't get to really personalize too much within these systems, but that's kind of a fun thing. What this is actually telling me that my mood disorders book list, this is my schedule for today. So you can see here I have all of my resources up at the top, and then I have my appointments booked. Depending on the clinic and depending on the type of appointment, it will be in blue, it will be green, it could be purple. We have virtual appointments, we have walk-in appointments, and then we also have whether they've been checked in and registered or whether or not they're pending that the appointment is coming in. So that's what this is. This is our scheduling thing, and I'm going to show you how to do a scheduling appointment in just a little bit. And then we also have, this is our power chart, right? So this is basically where we do all of the registration. So if I needed to do a one-of registration, I can do it from here. When I do my registration from my scheduling, it actually takes me over to this module. So it's a seamless transition from the scheduling module over to the registration module. These screens are all opened, and then we continue with the registration to get the patient registered in. Some of these buttons down here, the bed board, this is something that actually unit clerks will be using. It's not something that our registration clerks will be using. Work list is definitely something that our unit clerks or our registration clerks probably would be using, depending on the workflow of the clinic. And these are different work lists that they would have to action. So if they had a deceased patient with active encounters, what that is that in my clinic, they have an active account. So I would have to go in and I would have to manually update the account. I would have to discharge it because this patient has been deceased. And with that, a work list would be telling me, I would have a nice little sheet there and it would tell me what work I would have to do. Again, our request list is another one that our clerks would be using depending on, you can see there's a lot there. There's probably only going to be one or two depending on the clinic. And again, this is my work that I need to do today. Okay. Inquiries isn't something that we use. Revenue cycle elections isn't anything that we're using as a clerk, and the new group isn't anything that we're using as a clerk. Okay. Does anybody have any questions yet? I don't have because I have two screens open, I'm not reading the chat. So if there is anything in the chat. Okay. So nope, everybody's good. Perfect. All right. And then here's our work queue monitor. All right. So with the work queue monitor is right now, because we are in a test environment, you can see that I actually don't have a mood disorder one up here, and that's okay. What this is external. It can be an external or an internal, but generally the external referrals that come from, say, a general practitioner's office, they will fax it to the number. It will get sorted through the computer system, and it will come into my clinic. So I would check this every day. I would action it. I would create the conversation, and then I would be able to put this into my work list, and then I could action whether I would put a pending or whether I would put them on the wait list or whether I would schedule the appointment. We also have here this unknown queue here. And what the unknown queue is every so often there could be one referral that just kind of slips through my ketamine clinic and it goes to the unknown queue, but it is mine. So every day the clerks, they will be coming into here, they'll be looking at the unknown queues, and then they will be resorting it and repurposing it over to their own clinic. And then once I did that, then it would actually appear on my list here. So this is our external referrals that will be coming into the clinics every day. From a workflow perspective, this would probably be one of the first things that our clerks would do, is making sure all the referrals are there and that I have actually been able to get them routed from the unknown queue, and that I would have the referral status, I would change them to being triaged if that was the step within my clinic, or I would action them. Okay, so that's kind of a high level 4 different modules that our scheduling registration clerks would be using, and they all talk to each other, because you can see here from the power chart, I can actually access these from here. Okay, does anybody have any questions? Nope. Okay. So basically, all right. So the first thing that most clinics will be doing is we will be doing the external triage, and that's coming back over here to our work queue monitor. Okay. So with this specific clinic, with our mood disorders clinic, is they do have a clerk. What they do is they will put it through, it will be ready to triage. Then they actually have a triaging provider. So there's that extra step that once the clerk has done their job, the clinicians do their job, it then comes back to the clerk before I actually would accept it. So if it's an accepted referral, then I would actually put it into my referral encounter work list on the PM office. I would either accept it, I would reject it, or I would pend it. So there's a couple of different steps there. Okay. So so if I was to, I'm just going to show you quickly how to actually move out unknown. So if I had this as an unknown, all you're going to be doing is you're going to be opening your application and making sure that it's open. And if I look through here, I can see that maybe one of these is mine. And right here, because this is a test environment, not everything is exactly how it should be in live. but you can see here that all of these are available for me to action. So if it was incorrectly sent to the wrong thing, all I would do is I would be able to click on, I'm just going to click on one. None of this is anything that I've put in there, so I'm hoping I can action it because you can see it's been there for a while. Let me see if I can actually open. Okay, so here's one. Okay, so the only thing that you are going to be doing is you actually double click on so everything with this site is, it's a website. So your mouse is actually one of your best friends. And you can see here, the add modify work item pops up. So making sure that this is what's in here. If this had multiple pages, you would see the multiple pages here. You don't need to do this for every single page. And then all you're going to be doing is you're going to be rerouting it to the new location, right? So all I want to do is I actually want to do to my queue routing. And then here I can select where this is going, right? So anything that is actually on Cerner, I can route to. So you can see here that I've got Mount St. Joseph's, I've got SPH, I've got VGH, any Cerner site I can reroute to. So then what I would do is I would select my route crewing or my queue routing where it was supposed to be going. And then what I would do is that I would move it over, I would hit my route, and then it would appear in my different clinic. I'm not going to action this only because I know everybody's still playing with this at UBC because the go live is happening pretty quick. And this isn't my document that I entered in there, so I don't want to use somebody else's document. Does anybody have any questions on how to move an unknown queue? No? Okay. So again, within that add modify workbook, so I'm just going to use this one again. Just going to double click. And I apologize, I'm working from a Fraser Health computer and the Citrix doesn't necessarily like me that much. So it's very slow for me and I apologize. So all you do is double click and it's supposed to open. So with this add work item, if this is in my clinic, I don't need to reroute it. So what I'm going to be doing is I'm going to be now adding a patient onto this. So what I first have to do is I have to add the patient. Asking why I have to add the patient, because I need to actually put it to a patient within CST Cerner. It's floating around right now, not attached to a record. So what I'm going to be doing is I'm going to be attaching it to the record. Once I attach it to the patient, my patient actually will use I'll use the proper search. I will go up to the EMPI, which is the External Master Patient Index in VPP. In Fraser Health, we actually call it the Enterprise Master Patient Index. But what that is it's actually now talking up to the province. So it's ensuring that this person is this person. When I attach it to the patient, then what I do is I actually am going to be adding an encounter. An encounter is an account. This is going to be this encounter type. You can see up here, encounter type. But what I'm going to be doing is I'm going to be attaching it so then I can actually schedule an appointment. I can book an appointment, I can do something, or I could add them to the wait list. Once I do that, it would be in my clinic, and then I would be able to bring over, I can actually use it either in, I can register it, or I can book it, okay? And actually, I'm going to see, even though that's not mine, I really do want to be able to kind of show you a little bit more details. So I am going to see if I can search a patient. Now, with this, as this is a test environment, I probably will not be able to call up a patient. They probably will not be found, and that's okay, right? So then when I would be doing this is obviously I would be resetting my, right? I'm going to be doing an MPI search. I'm going to select my facility. Now this seems every time I have to do this, right? And then I hit search. There's my mood disorders. I'm going to hit OK. It's looking now in the EMPI to see if this patient exists anywhere up in the province. As this is a test environment, it shouldn't find anybody, and it doesn't. If that person was here, I would select that. They're not here. I'm going to hit cancel. Okay. If I need to add additional search criteria, I can search by the PHN, the MRN, last name, first name, date of birth. Some of them actually will require to have multiple, so I need my last name, first name, date of birth, and then I would reset and add different search criteria. Because I don't know any of this, what I'm going to do is I'm going to add a person. It's looking for the EMPI. So if the person did not exist within the system, I can actually request a PHN for this person. What a PHN means, it does not necessarily mean MSP eligibility. It does not mean that they have insurance. Every person within the province of British Columbia that has any kind of a healthcare encounter within a health authority is issued a PHN, and that follows them for their entirety. So somebody who comes here every 6 months from the United States has a PHN, but that doesn't mean they have MSP. With a PHN, obviously that is the best search. With this situation, I can actually create a test patient here. And of course, we're using our best practices. We never really want to use real people's names within our training environment. The reason why is if there was something that accidentally triggered the training environment over to the real environment, to the live environment, we wouldn't want to have any real sounding names, right? So here, obviously my person was not born today, so I'm going to select a different date. And you can type in, so it's here. Sorry. Oh man. So you would type in the date, or you would select the date. So we're going to make this person this old, and they are here, male, female, unknown, and undifferentiated. I know that it's a female. All of these little stars are mandatory questions, right? So we are going to fill them in to the best of our ability. And then down here, I'm going to hit submit. So now what it's doing is it's actually talking up to the EMPI, and it's going to request a PHN. So you can see the PHN is in process, and I'm fine with that. I really don't care. So I'm going to hit complete. I don't want to wait for a response, but I'm going to continue. These are the registration screens. So as I'm adding an encounter, which is I'm trying to flip my brain back between Fraser Health and VPP, so I apologize. As I'm adding an encounter, what I'm doing is, here's my encounter type. So I'm adding a referral, right? And here what I'm doing is I'm adding a psychiatry medical service. With all of these red starred ones, they are mandatory. A lot of them are drop downs. You can also do your search, so you can do consults, right? As you're going through your patient information, here's my address, the phone number. So let's put in a phone number. And it's going to be the mobile, right? If they have a mobile phone number, I can put this in. Oh, because I said it was a mobile phone number. So here, let's get rid of that. Okay. With some of these down here, this is registration. So what we would do is we would try to fill in as much information as possible. I have a piece of paper in front of me. I am not talking to a client, so I cannot answer some of these questions. So I don't know. As a registration clerk, as a scheduling clerk, unless I can verify the information by a family member or the client, the patient themselves, we can't actually verify the information, so we would leave them blank, right? So here's my encounter information. Depending on the clinic, I may or may not have to fill in some of the information. And so here it's asking me who my doctor is. I'm not going to be saving this, so I'm okay with just leaving it blank for now. Here's our insurance screen. Again, if I knew this person had a PHN, the MSP eligibility would pop up here. Guarantor. Now, for most people, we know what it is as an RSDQ people because we fix these. A lot of clinics don't realize what a guarantor is. A guarantor is the person who is the most responsible person for payment if there's additional costs. And we know for children 18 and under, that generally happens to be one of their parents, their legal guardian, if that's a piece of paper from the courts, but generally it's mom or dad. And for most healthy adults, people that have MSP coverage, it's themselves. So we would go through with the insurance, but you can see here right now, none of this is mandatory because I can't confirm with the client, right? And I don't have an PHN, so that's why it's not coming there. Insurance summary isn't really anything we need to look at. Additional contacts, depending on the encounter type, depending on the different kinds of registration, I may or may not need to have a contact. RSDQ, we really want to make sure every encounter has a contact. How we sort of explain it to when we're training like an emergency room clerk is, if that patient was to die today, who can we contact? So we really do want to make sure that there is an emergency contact. Sometimes you can't get it, and that is a total different workflow, and we can show you how to do that later. And then after you're finished all this, all you would do is come down here and hit complete. Because I don't have a PHN and I don't want to actually use this, I'm just going to hit cancel. And I am going to cancel this conversation because I don't need a pre-registration right now. Okay, so I'm just going to cancel that. But that's how I would add my patient or my person over to this requisition. So it takes me from my work queue monitor right over to my PM office, and it's seamless. Does anybody have any questions? I'm kind of going a little fast. No? Okay, perfect. And so what we've done is when you're indexing a referral, there's also down here in the document type. So if I was to index this document now is going to live on the electronic record for this patient. So what I need to do is when I'm indexing it, I also want to make sure I name it properly. So everybody has seen an EMR. We know that within the EMR, within a visit, there could be multiple different documents. That's all that means, is that when I'm actually indexing it, I am giving it its proper name. So over here, before I'm even out of my work queue monitor, I'm also going to be giving it its name. I will select what it is, and that also helps with the routing. Okay, and then when I route it, then I'm going to complete it, and then it's scanned down here. There's a little button down here. Oh, I don't know why it's doing that. Down here. I don't know why it's not letting me scroll down. Under the referring physician. So what this is underneath the status, so I would make sure that was complete. And then down here under the provider, what we would say is that it's a scanned document. So then once I do that and I hit complete and I hit OK, this now belongs on that EMR. So this now is part of the client's electronic record. Okay, so that's kind of our work queue monitor. Does anybody have any questions on the work queue monitor? I'm not really looking at my team, so if you do, nope. Okay, perfect. All right, so let's go over to our PM office. Here's our PM office, and here's our conversations, okay? So if I needed to register someone, I'm just gonna quickly, so I'm going to do a register an outpatient. I'm going to click on this. It's loading my conversation. And then what I'm doing is, we've already seen this screen, it's making me search for my person. Again, I'm going to search for my PHN. If I don't have it, I will do other search criteria. If I can't find it, I will add the person. And then after I find the person, then I go to those gray screens that we just saw, the registration, and I continue through the registration, right? So as I say, everything is pretty seamless. Over here, we also have our, so that's the registration conversations. We also have down here our work list, okay? So with our work list, we have our referral encounter work list, okay? So now this displays, it's a very small pop-up, it's very small, but what we want you to do is, what we were going to be finding is I want my UBC, right? So you can type U up there, but what I want is I actually want my mood disorders. I'm going to copy it over. Oh, sorry, I have to go all the way down to the little wheelchair. Once I'm at my wheelchair, then I can copy it over. And then I hit OK. And then this is actually now where my referrals come to. So if I have a referral list, this is where I have now put the referral from the work queue monitor over. As a clerk, it's ready for triage. So this person here knows, then my clinician knows to come in and be able to go into this one, whether or not they're going to accept or reject. If they accept or reject, it comes back onto this list. I refresh. Now as the clerk, I'm going to do the next step. So if it's rejected, what I would do is I would go in, I would discharge the referral from the clinic. I would contact the general doctor, the GP. the family physician on why it was rejected. I would either send a letter that maybe it was more information or it was a inappropriate referral for our clinic, and then I would drop it off. I would complete it and I would drop it off here. So this is my work for today. So that's what this is, as a referral work list. Okay. So yeah, as I say, if it's canceled, if it's rejected or anything like that, all we want to do is we want to discharge the encounter. So if I was going to discharge the encounter, right click on the mouse navigates really well. So you can see here that I could go over to the conversation, I could call up the patient, and I could do quite a few steps. The mouse is actually eliminating some of these steps because this is the one that I actually have highlighted. So what I'm going to do is I'm going to discharge that encounter, and it pops up my conversations. And that's okay. It's because it's in a train environment that all the PHNs are weird. And then all I would do is just go in here and I would just discharge this encounter. So anything that is yellow with the star means that I have to mandatorily, I have to fill them in. So I would go in, I would enter all that information, and I would hit complete. I'm not going to because this isn't my student. I'm just going to hit cancel for now. But then I would go over here and then it would be refreshed and it would be dropped off my list. Okay. So right click is definitely something that we like to use within CST Cerner because this is a website, this is a web-based program. So you'll get used to as a clerk whether you use your right click or your left click. Okay. So in our scheduling appointment book, so here we have this. We can also look for our work lists through here as well. You can see over here our request list inquiry. So I'm going to select here, and this will also give me my work list. Okay, so what I can do here is my future requests, which is pretty much the same thing I just looked at, ambulatory and my mood disorders, and then I can hit find. And this is also giving me a work list. So depending on the clinic, depending on the clerk, we'll be actioning either through their scheduling or through the PM office. So then again, here I would go through, I can see that this one here is next available appointment. So clinicians have put this information in for me. And so then I would go through and I would be booking the appointment. Now over here, you'll see there's a visit modality in these lists. Everybody knows what visit modality is, right? So visit modality is what type of appointment is this? Whether it's a virtual appointment, whether it's a walk-in appointment, how it is from Zoom, it could be a telephone, it could, or anything like that. That's all that's saying. So depending on the clinic, we'll have different criteria in here. So you'll see here, this one's an in-person clinic. They want it for a reoccurring group for 8 weeks, or whether or not I'm going to be doing a video Zoom for healthcare. Okay, and so that's all visit modality is. And this is just another way for me to be able to do my booking because I've got my list called up. Okay. Does anybody have any questions yet on the lists or anything? Please jump in if you do have any questions. I know I'm going pretty fast.
I got a quick question.
Yeah.
I got a quick question. So Kelly, you showed the work list, right?
Mhm.
Previously, this is a request list. The work list where you were last, and it was saying, rejected, and then you showed that how to discharge. Are the
Yep.
clinicians accessing that same work list to do their piece, or they go
Yes.
through a different method? Okay, so
they go through a different area, but yes, it's accessing the same list. Because what it is with this, Karen, is this is telling me that they've gone through and they've said, yes, we've accepted it. If it's accepted,
right.
then
But
it comes over to
I
here.
totally get it. I just
Yeah.
wondered in what mechanism were they actually using a work list to do their piece, or do they use something different to say we're going to accept this, we're going to reject it, we're just going to, all
You
of
know what?
that.
That's actually a really great question, and unfortunately, I'm not sure because I've never seen the clinical side. But that's actually a really good question, and I can take that offline and I can find out for you.
No worries. Maybe Abraham, do you know? That's okay.
I don't actually.
Okay,
Yeah.
nope.
That's a really good question because I haven't seen the clinical side, Karen, so I'm not 100% sure.
I know, and I don't even know. Like
Yeah.
I didn't think that clinical actually went into request list, so that's why I was curious. So maybe I don't know. Maybe there's a different way that they
Yeah.
access it. It's not that really important. You're doing the right thing in training us. I just was wanting to connect that big picture
You know what? Well, and that's kind of like what we're trying to do, right? Is we are trying to connect that big picture. So that's actually something that, it's. I wonder if maybe Cindy would know that question. Like one of our URs, the actual VPP URs and everything. It is a good question, to be honest, Karen. I mean,
okay.
I am going to make a note of it. Right.
Thank you.
And I will find out. I will find out and see what they're doing.
Okay.
Okay. Yeah, so if they've accepted it, then it comes over here over to my lovely list over here. And then here I know that I need to action all these, and then I would go through and I would schedule as needed. Okay.
And so correct me if I'm wrong, because this is going back a bit for me. So what happens is if they have accepted the referral, the clerk will come in from here.
Yep.
Does she go and add, like, how does she add them onto the request list? Does she start from here? Because I know all these work lists are, or sorry, this is the request list, but
this is the request list. Yeah. So what this is I'm actually now in the scheduling appointment book.
Yeah.
So now
No.
Now,
I meant the work list. Like if you're in the work list and there's an accepted, right?
This one. Yeah.
Yeah. And there's an accepted. Now, how does she get it onto the request list from this point?
These actually go over to the work list. So what it is that I can actually go. So say this one is here, right? I can actually come over here and I can actually register from here. So I can pre-register them here.
No, I know, but you know what? The request list is actually in scheduling, I thought. Okay, never mind. I'll let you go through it. It could be me being confused. Don't worry.
No, it's good.
Yeah, don't worry. Good. You go on. I just wondered, how does it go from the work list to the request list? Is there a duplication or do you go from one to the other?
So when I'm in here, right? So what I've done is I've put this. So when I'm in here, here's the requisition.
Yeah,
I've now put it here, right? So what you're asking is now, as me as the clerk, it's as I reject it or ready for triage. What does that mean? If it's ready for triage, it's for the clinician. They have to do something. They are supposed to, from what I understand, and this is where we need that clinician piece that we're missing right now, Karen, because I get what you're asking, is how does it go from here? My clinician knows it's ready to triage. They've triaged. And now how does it go onto this list?
Exactly. That's it.
Yeah.
I think what they do is they schedule it from there somehow, but I wasn't sure how. Okay.
And that's the piece the clinicians are supposed to do if the clinic has that piece in there, right? So because the ready to triage needs to be done by a clinician, I 100% do not know what they hit to get it onto this here for the clerk. And that's where I'm going to take offline and I'm going to ask Cindy. She might know.
Yeah. And I
just want to mention that in one of the videos that we just have for the training, it said that the clerk have to monitor both lists. So when he's see in PM office that the request was accepted, the referral was accepted, they have to refresh the list and go to a scheduling book, select the patient, and do the schedule. So it's what it says in the material.
Yeah, they have to monitor both lists. Absolutely. But this list here, going back over to this one, this is not where the clerk knows if it's ready for an appointment. You can see here it doesn't have all of the same fields. It has some of the same fields, but this is not where we're telling them that they go to actually book the appointment. This is where they would go to discharge the encounter, right? But we're not telling them this is where they go to do the scheduling. We actually are telling them to come here to do the scheduling. Right, so it's best practice.
If I'm not wrong, in the PF, the referral status should be accepted before you go to do the scheduling. Yeah.
Absolutely. And that's where it comes to here, right? So this is the piece that we're kind of missing is the clinician.
I think what they do, if I go from memory, it's a very, very distant memory. I could be wrong. The part of the clerk, what she does is if it is accepted, then what she does is she takes it somehow from here and then adds an appointment, or she goes to scheduling and adds an appointment, schedules it and then she clicks on request lists. So instead of actually scheduling it all the way through, she enters the information in the accept format and then she hits request list and selects the request list that it goes to and links it to the encounter, into the referral encounter. I think it's the scheduling clerk that does that piece. I think that's what
From
I'm
my
hearing Alfonso
understanding,
say.
Karen, what he says, right, they can create a request like that through scheduling, but normally you have the referral encounter, it lands on a list that clinicians can access several different ways, apparently. And then when they accept it, they're doing so through an order. Usually it's an accept referral to so-and-so clinic order, and that order actually generates a brand new request, which lands on the future request queue. And that's what they're actually booking off of.
Yeah.
They do have to monitor the work list to clear out the rejections and anything that might have slipped through for whatever reason. Someone might maybe deleted a request, but primarily it should be work list. Requests should land on there. They should be booking off of those. Or if it's a clinic that is using the old accept referral order for whatever reason, the original request should be on a wait list or another triage list. But there should have been a request already existing for each of these or being generated by the accept order.
There is that's why we attach the referral to the encounter. So there is a pre in here, right? The clerk has to initiate that. That's that pre, right? So I've got my, where's my little thing here? I've got this. The clerk attaches this to that pre. That then goes to this list, ready for triage. Once they've done that,
this is a step. This is from here to there. That's where I'm wondering what's going on.
And because I can't, as a clerk, I have no access to CTAS to triage. I don't know, because I don't have a button that I can actually move this, right? Like this is ready for triage, right? I can load the conversation. So I can actually go here and I can discharge the encounter, right? I don't want that. I don't want that. Hold on a second.
That's okay. No worries. I think what I heard, it's totally fine. I could be derailing it, but I think to summarize, Abraham, just to make sure I got it right, what you're saying is when clinicians are accepting, part of it is they will then create an order on the backside, and the order kind of dictates it going onto the request list. Did I get that?
Exactly.
Yeah, I gotcha. Okay.
So Karen, if it is my workflow, right, I can actually go in here. So because not everybody has ready for triage. So I can actually, as a clerk, because as they say, depending on the workflow, I can go in here and I can go to the encounter summary, or not encounter summary. I can actually go in and referral management, and I can add the referral. I can update the referral from here as well. So then I can change it from ready to triage to book, right? But depending on the workflow, mood disorders, they aren't booking from here. So I can actually change it to complete. I can change it to a couple of different things. Like here's my patient information and my encounter information, right? So then I can change it from a referral. See, as a clerk right now, I can't, right? I don't have access. So underneath, my username doesn't have access, right? So maybe that's probably where they're coming from, right?
Okay.
Okay.
Thank you.
I will definitely follow up for you, Karen, because it's interesting to know, because I'm not sure.
No worries. Thank you so much.
Yeah. Okay. But generally what we're doing is we're training everybody that what we want you to do is we actually want you to book your appointments from this scheduling appointment book from the request list inquiry, right? So what we're doing is, as I say, we've opened it, we've got our list here, And then what we're doing is, because everybody already has an encounter existing, because we created the referral. So we don't want you to create a new encounter. All we're doing is modifying, right? So all we're doing is we're going to go on an accepted referral. We're going to right click, and you can come down here to modify, okay? So all we're going to be doing is changing it from a pre, basically, to we're either going to book an appointment or we're going to keep them on the wait list or something like that. Right now they're on the wait list, right? So what we're going to do is then over here is we're going to set an encounter. So we want to make sure that this is the appointment I want. I'm confirming all my information. And then I come over here to set encounter, right? So then I want to make sure. So this here, again, my patients have lots of them. You can see here that this patient's been used for quite a few bit. I want to make sure that I've actually got my encounter. So I'm looking for my psychiatry right here for my mood disorders, right? I'm going to select OK. And it's thinking. I don't know why it's not. Where did it go? Where did it go? Let's try that again. I might have too many things open. Sorry, guys. Try this again. So again, with the correct one, I'm going to hit modify. Event locked. Okay, it's open somewhere else. Got my person. I want to hit set encounter. I'm going to find my psychiatry one. Add encounter. The conversation I would like to do. So this is where I'm going to pre-register, register, anything like that. So I'm going to pre-register an outpatient. Facility name. Again, I have to select my it's finding my person. And then once I'm at that point, then I'm going to be selecting my appointment. So this would be my pre-register. I can do all the pre-register here if I needed to. Just going to cancel this. So here's that modify window. So this is what pops up when I do set my encounter. So what I'm doing is my reason for visits defaulted, my order and providers defaulted from the pre. What I'm going to be doing is my referring provider. I need to continue this. So I'm just going to do test Alex so I can move a pen. The date received, interpreter required, no. Visit modality. So this is where, depending on if it's an in-person or if it's a Zoom call or it's online, I will select what it is. For our purposes, we're just going to do an in-person clinic. Depending on the clinics, they may or may not have the automated appointments to patients. And if so, this is where this comes in. So do you want a reminder for the appointment? What's the phone number? With this is that we have to remember that if I do an automated appointment, I can set it for 5 days, 10 days, 15 days, depending on what my criteria is. If an appointment's changed within that window, the automated report does not work. So the clerk will have to actually call the patient themselves just to say that, oh, I actually want in-person clinic. So then, and language is something that depending on my clinic. So some of these fields aren't mandatory, but some of them may be just based on whether or not I require them for my clinic, right? So then I'm going to hit OK because I'm happy with all my details. And I'm just going to, might pop up somewhere on my computer. I don't know where that pop-up just disappeared to. I apologize. Oh, there it is. Right. And so then what I'm going to be doing in here is I'm going to, is this the same one? Details. I'm not sure why this did not take. Huh. I don't know where that, my feature request is not. Where did, I'm sorry guys, because this is not, like, I don't know where that pop-up has popped up. It should be popping up another thing that opens the future request appointments window to be able to allow me to actually schedule an appointment. Because I need to be able to come over to this and actually call up my appointment, my work in progress, and actually book the appointment. And for some reason, I don't know why, it's not letting me continue past that. It's just closing it. You saw that there was a little window and it's not letting me do that. So let me move on. But what should happen is it should actually come over here. I can actually have my appointment. I would move the person over to my work in progress. My work in progress is who my patient is. I can either schedule, I can request, which means I put them on the wait list, or I can book in a reoccurring appointment. The reoccurring appointments are for the same appointment in a multiple weeks. So it could be like an 8-week group session. It could be something like an IV therapy or anything like that. And then what you would do is you would call your patient over here, the work in progress. I can drag and drop, I can schedule or anything like that. And then I would create it. And then down here on my screen, it would come up with the appointment on the scheduling grid. And I'm sorry, I don't know where that pop-up went. I've tried it 3 times and it's not letting me continue with that. So I apologize, but it is in your workbook. It's exercise number 3.2. So when you guys take this offline with your usernames and your passwords, please go in and play. All the steps are there. You're going to be adding your conversation. You're going to be going through the registration pages, complete as you can. Please don't make anything like with your patients, please don't use any real names, and then just continue through, and then you'll be able to save it. And I apologize, I'm not sure why mine's not working properly. And because mine's not necessarily working properly, I'm going to try to see if I can actually show you how to book a wait list. Same thing in my appointment. You can search by your person's name here. What you're going to do is you're going to hit on the little ellipsis. It's calling this patient search up. So if you need to go in here and search for your patient, depending on your workflow, you're going to come in here, you're going to search for your DHN. I won't have one. No person found. You can add your person if you needed to, but generally what we want to do is we actually want to see if we can find a patient. So I'm just going to be here and see if I can find a patient. Okay, so if I had my patient, then what I would be doing is if I'm looking for my patient up here, but what I want to do is I actually want to look for the encounter. So I want to make sure it's actually my encounter. So I'm going to be selecting this referral for psychiatry, right? This is one issue that we have with certain clinics. You will have those patients that have multiple possible appointments within the organization, within the acute site. So we really want to make sure that we have the correct encounter. Okay, so we're going to select it. And then what we're going to do is we're going to add, modify. Again, it's going to be searching for my patient. Close. I want to continue with the conversation. So we always have to add a conversation, regardless if we're booking an appointment or not. So we're just going to do, I can do a referral management, I can do a pre-register, I can pre-register a patient to a bed. For our clinic, we're not going to be doing the pre-registration to a bed, right? So what we're going to be doing is we're going to continue with this. If I was going to continue with my conversation, I'm just going to pre-register an outpatient, which is fine. It goes up to the EMPI again. There's quite a few times that the MPI and the EMPI are asking, especially in test environment, because none of these people actually exist. Right? So this is my pre-register, my patient. I would complete all of that. I don't want to complete any of that right now, but I would continue with that. And then what I would do is my patient would pop up in my work in progress. And then I would have everything over here. I would put them over here into the move. Then I would hit the request, and then it would add what list I would want to put them on. So then I would want to add them to my request list. I would want to add them to my wait list. And then onto my future request list, and then they would live on my wait list. Anybody have any questions on that? That was kind of high level because my pop-ups aren't working properly, so I can't continue showing you guys exactly how to do it, and I apologize. No? Okay.
I got a quick question. I heard that sometimes some of these clinics can have multiple request lists. Is that right?
Yeah. Yeah. Absolutely.
Yeah.
That's
because they're moving it off
of
one request list to another request list, right? Which
they can.
Also is kind of time consuming and aggravating, and I don't think they like that.
Absolutely. Like I know specifically for this clinic, Karen, the clerk monitors the ambulatory brain health future requests, as well as the referral to outpatient list, as well as the the referral management, the accepted referral. They've got massive amounts of wait lists that they have to check every day.
Wow. Crazy.
Yeah.
Okay.
Yeah. So with the internal referrals, I'm just going to go back to Power Chart. So here's our referral management. So this can also be when it's an internal referral with triage, right? So if there's an internal referral from triage or with triage, what this is that somebody within Cerner has requested something. The external one is let me just go back here because I did close it. Let's see if I can open it. Is the work queue monitor. Work queue monitor is external, whereas referral management is the internal. Depending on what the clinics are actually doing, I will be 100% honest with you because I haven't seen anything go live. I'm not sure how the internal is working because right now I can't internally send anything other than what I'm playing with right now because I don't have access to that. So, but what in your activity 4 is where it describes what the internal referral with triage is, that you're going to be tracking your internal referral request list. There is stuff in here that you can play with because the clinicians have put stuff in there for us. Okay, so all you're going to do is in your scheduling appointment book, your request list. So you come over here again, right? And then they should be on here. So then you hit your find. And this is where it's supposed to be, right? So these will also be internal referrals. Okay, that will live on this list as well. All right, and again, everything is got something, so you're just going to right click, you're going to modify. You're either going to be taken to the future appointments, you're going to create like you're actually going to book an appointment, or you're going to put them on a wait list. Those are pretty much the only two options from here once they've been accepted. Okay. We're creating the referral account management. That is the wait list. You can cancel the requests. So you can actually cancel the requests in here as well, right? So you can see here what I've done is my right click. If it's black, it means that I can actually action whatever this is right now. If it's gray, it means I can't do anything with it right now. So I can't check this in or check this out. I can't hold it. I can't reschedule it because it doesn't have an appointment, but I can hit cancel if I needed to. So if I needed to cancel this, all I need to do is just hit the cancel. There's down here cancel request as well, depending on the clinic and depending on what you're doing. Generally, we ask you to use the cancel request because it's the long way, right? So then you go through and you make sure you're not missing any fields if you have to do the cancel reasons. So we ask you to do it that way. If, as I say, if I'm putting something on a wait list, again, I'm taken to here, right? So what I'm going to be doing is going here to my list, and over here, I'm going to look for my wait. I can look for my wait list. So I can move my request. So here, right, I can actually move my request. So now here's another way to move my wait list. So you can see here that this is the list that it's on. And if I want to just quickly do this, my wait list down here, if I have one, I might not have one down here. Not all of this is here. So I actually don't have a wait list in this. Oh, actually, they might have it here. I don't know what these partnerships ones are, but I would select my wait list. So right now I don't have a wait list, but I would just go over here, select it over here. I'd remove it over there. And now it would show up on my wait list because it's not giving me a wait list specifically for this. As I say, this is a train environment, so it's not exactly as live, but I can actually move it. That's the easy way to move this request over to a wait list versus going through the whole process of scheduling and putting it over onto the request. That's the easy shortcut way, which is kind of a really cool way to do it. Okay. If I was to book an appointment from a wait list, same thing. I'm going to be calling up my list, same as I just looked here. But it'll be my wait list. I'm going to select it and I'm going to hit modify, right? And then what I'm going to be doing is I'm going to be going into my details. I'm going to be putting my referral. I'm going to be doing everything, and I'm going to continue. That it takes me, once I finish with this, then it takes me back to my book. My person would be over here. I would actually have them in my work in progress. So it'll tell me that Sam Smith, what the appointment is. Then what I would do is I would select them. I would come over here. My button, my schedule button would be black. So I could hit schedule, or I could just drag them and drop them depending on my workflow as a clerk. It's depending on how I want to schedule, but I would schedule the appointment and then I would confirm it. Most of the time, clinics will also do the pre-conversation. The reason why our clinics do pre-conversations is because if it's in a pre-status and not a scheduled status, it means you can actually start charting on it. So you can start printing documents if you needed to have documents, and the clinicians can actually start actioning something within the chart, within the appointment. So that's why we always normally attach the pre-conversation. So like a pre-outpatient conversation onto it. And then once the patient actually arrives within the clinic, that's when we as registration staff flip it over to the registration conversation. Okay. What else is in here? So one of the things that they will also do is they also have follow-up appointments that, depending on the clerk, what they would do is they can actually complete requests. So again, back over here into this list, you can see here that we actually have complete requests. So once I've done it, once I've accepted everything, then I come back here and I hit the complete request. I'm not going to actually do it. But then what I would do is I would do the complete request. I would hit OK, and then it would drop off my list. Right. So the clerk has to come in here and actually complete something. And that tends to be most lists within registration systems and scheduling systems, that I have to go in and I have to say, okay, I've done it, I've completed it, I've accepted it, and then it drops off my list. So then now I know it's not on my list, and I don't have to follow up on it. So that's the complete request. What else? The work in progress. So if the patient has arrived, there's a couple of different things that we can do.
Kelly, sorry. I'm so, okay. I just was trying to absorb that. I kind of thought that completing a request would take you onto the scheduling, like it would put you into here so you can complete it, but that's not what you're saying.
That's modify. So to modify, I'm modifying. Yeah. So if I'm actually doing,
Okay.
Yeah. All this complete request is on this screen specifically is I'm removing this line from this list.
But I thought when you scheduled it, it actually took it off of here because it's gone from request. Because don't you just take essentially when that's there, it's just partial information that populates onto the scheduling screen, and then you just go on to book it.
You know what? That's a great question. Because I'm not a CST Cerner user, I'm just going based on how the group has told me to do it, and they've said that we have to go into this. Like I know over on, so this is a good example. So I'm just going to sort of bring over from Fraser Health for a quick second. I know on the ABU orders with the online new ABU orders and client server, you actually have to complete. You have to, even though you've got the order entry and you've done it, you have to go in and you have to say it's complete, it's done. And the same, like if a clerk cancels it, they have to go into the other side and they have to hit cancel. So then then when you refresh, it's dropped off. And I think that's what they're saying this does, is the complete request drops it off of this list that I've done whatever it's telling me to do, right? Because with this one here, like accept the referral, right? I've accepted it, but I'm not telling this list that I've accepted it. And that's what I believe this is telling me to do, Karen. But as they say, I don't know specifically with this. I'm just going based on the workbook. And that's what they say that I have to do to get it off this list.
Gotcha. So what you're saying, just to make sure I got it, is that in order to book it off the request list, then you hit modify.
Yes.
But after it's booked, you still somehow have to select complete request to get it off.
Yes. From what I understand and from what the workbooks say, that's what I have to do.
Gotcha. Okay.
Like these follow-ups and stuff. Yes. Because yes, that's what it's saying. But you know what? It's a really good question. And I think maybe that's something that we should find out for sure.
Okay. Because I feel I'm going off of like old functionality.
No, you're good.
That's and so I could be wrong because, a lot has changed from the old to the new. So I was like, when I recall it, it was like when you go to take it off the request list, the information that's partially already there, the patient, the appointment, all of that carries over, but I'd have to go in and play with it and to really figure it out.
Absolutely. And unfortunately right now, because I don't know why it won't actually let me continue on to try to book. Like I keep losing my pop-ups.
That's okay.
I can't test it. I would love to be able to test that. So all of you guys that actually are over on the VPP that have better access to Citrix, please test it and let us know and see if it actually does drop off the list, because I'd be curious too. Right? Okay. So when a patient arrives, this is what the clinics are going to be looking at. This is my day, right? So depending on the color of my appointment, let me just actually see for tomorrow. Yeah. So what I would do is I don't think I have anybody in here. Yeah, I don't. I don't have an appointment. So these are all ones that I can book. Let's see if we've got anything from a previous appointment. I don't. All you would do is in here is if my appointment was in here, they're blue, green means that they've been checked in. I would go into my right click up into actions, and you can see up here I have a check-in and a checkout. This site does use check-in. I can't action anything right now because it's gray, but I would go into the check-in and then it would actually take me through to the registration screens, and I would check them in. Alternatively, I can select the appointment here, and then I can actually go into the check-in icon in the toolbar, and it is this little guy up here. And because I can't actually action it, it's still gray right now. Where is he? Right there. Where's my little check-in? There's a check-in button up here, but because I don't have an appointment confirmed, I don't have it actioned. Right. There's exit.
Yeah.
Right
if
there.
you click on the.
He's right there. He's right there. He's right there, and I can't actually action him because I don't have an appointment.
If you click on the one in the car animation, that appointment with the black box around it, then you could try to check in, right? It becomes active because that's actually an appointment.
Yeah. Yeah.
Right? Whereas
the
others, I think, are actually slots that you could schedule into, but the black is actually the appointment, which so I thought when they were so it just shows as black and white when it's in a confirmed status is what I'm seeing.
Well, actually, from what I understand, depending on the clinic, they have different colors. So if I had an appointment booked here for a client, it would be like a teal blue. If they were checked in, it goes to green.
Exactly. But this one is showing in confirmed status. So I expected it to be teal blue, but it's black and white.
And you know why? It's because these are the group sessions.
Oh.
Yeah. So it's a group session, right? And they check in things differently. So open one or more persons, open all persons. So these are the group sessions.
Oh, got it. So maybe the group sessions are a different color. Okay,
they are.
Perfect.
They are. And then also the Zoom calls are also different color depending on the clinic, right? So it's very visual, so the clerk can actually see. So yes, this is telling me I have these times available that I can book appointments. I know I don't have anybody because the system's not letting me book anything right now, Karen, and I apologize for that. But this is where, yes, if I had Kelly in here, I should be teal blue. I can use my check-in, my little check-in up here should be able to work, or down here, and it should take me off to the, it'll pop up the available conversation. I would flip my pre-register outpatient to my outpatient, or to my register outpatient conversation. Takes me through all of those gray screens we've already seen a couple of times. There's additional mandatory questions I need to fill in. There's also questions that I know I need to change, right? Because the encounter type is like, I was an outpatient. I need to add their primary care provider, whoever that is. I need to verify that. I need to look at the insurance tab. So there are more steps, and it's the full registration is the check-in. Yes. Does that make sense? Okay. And then
Danica, sorry. Thanks, Danica, for testing it. Did you take it off the request list and actually book it first and then, or did you just kind of right click and click?
So what I did was I went to the future request list. I right clicked and then clicked what did I click? Complete request, and it took me to the scheduling appointment book.
Okay, so
and then from there, once it's confirmed, I checked the future request list again, and it dropped off from there.
Perfect.
So you actually booked it then, Danica, when you hit complete?
For what date?
Takes
yes.
Okay, perfect. Got it. So that's what I was trying to determine. Thank you. That's helpful. Thanks so much.
Danica, what clinic are you in? Are you in the mood disorders?
No, I did the movement.
Okay.
Movement.
That's
disorder,
fine. Fine. That's perfect. That's perfect. Thank you for testing. I appreciate that.
Yeah, no problem.
That's awesome. Okay. So virtual health. Okay. So this is also too where these guys have a virtual health. Okay. In Power Chart, what we have is our ambulatory organizer. Let me just see if I have anything. I don't think I have any patients. That's the problem. So if I had some patients here within the virtual, think I have anything here. No. So in the ambulatory organizer, what it is that I would actually have in here a list of appointments if they were for the virtual appointments. And so because what happens with virtual appointments, they've attended, and now tomorrow I need to go in and I need to go and change them to a completed. So what I would do is then I would go through here. My clinician has put all of the information in here that they need to have. I would search my list. I would go through, and then I would then go back over to my, I'm trying to see if I can.
Yeah, I didn't get it. I didn't get it. Why am I going to the ambulatory organizer?
Okay. So what
I think you did. I think there might have been a typo. You put UBS instead of UBC.
Oh,
so maybe
okay.
there's some patients in there. There might be patients in there.
Okay.
Because I think you were looking for that, right? But not, sorry. Yeah. And then I kind of missed why I'm in the ambulatory organizer.
That's okay. So what if I'm over here in the so over here, let me just go back. So here's my list.
Yeah.
So some of these here could be Zoom calls, right? So up here and everything like that, what I need to do is I need to put these back over to the ambulatory organizer so the clinicians can actually see that they have virtual appointments, because the virtual appointments, they live on this list, right? Does that make sense?
Yes, but
okay.
Isn't it when you book it, then it comes over here automatically? Right? Is that what you're saying? Sorry,
yeah, so,
might be a little dull.
Sorry, I'm jumping back and forth. So the ambulatory organizer is yet another list, Karen.
Yeah, yeah, but I think what it is, that's what the clinicians use. I got it, but I think once it's kind of like once it's booked, isn't that their patient list? Like it comes over here?
Yes. So this is where the clinicians will see that they can go in and they can add comments and everything over here.
Exactly.
In the ambulatory organizer.
Okay. Got it.
Then once it's there, they've done everything. They will change in here if they've seen them. Then it comes over here. Then I will go in and I will be able to update the information, because a virtual appointment is basically checked in like the next, because I can't check them in. I don't know, right? So then it'll be on my list and I'm going to complete my requests, right? And then I'm going to go through, I'm going to select, put in all the details that I need to put in, right? Does that make sense?
I got it. Yep. No, I got it. Sorry about that. I missed it. So basically what you said is for virtual appointments, you're just showing the clinicians what they do is they go in, they'll take it off the ambulatory organizer. It's their patient list, right? That once the clerk has booked everything, it shows up there, and then they do what they need to do, the documentation when they see, and then the clerk uses that information. She goes in to see, did they actually see the patient somehow?
Yeah. So in here, unfortunately, I don't have a list. And so it's making it really hard to see. So what I'm going to do is I'm just going to pull this. No, I'm going to pull this over. So this is the workbook. So what they would do is this is the arriving the virtual appointment. So this is what I would see, right?
They would arrive it. Got it.
They would arrive it. Yeah.
Perfect. Okay.
Yeah. That's all it is because that's where the clinician has the access. So what it would be is that if I actually had a lovely list, I would have my arrive down here, and I don't have any, like at all, because we haven't been using this, right? So then they would come in here, I'd have my patients for my mood disorders, then I would hit my arrived. And this is all 6.2. So this is where you guys can get the details in 6.2. But yeah, it's just that I would hit arrived. So with Cerner, they really are using 4 modules every single day, multiple times, right? Wow. To be able to access, depending on the clinic, because virtual check-in is different how we would check in normally through here, right? Like I would just want to go in here, I would do check-in and I'd be done. But what they're saying is for this clinic specific, and so this is where Karen, coming from the Fraser side, I'll be 100% honest with you, I do get really confused because these workflow books were created with the clinics, and this is what the clinics are currently, like, this is how they say they need it done, right? And so that's where I got confused. Like when I was reading this workbook, I'm like, it doesn't make sense. Why do I have to go there, as well as going back to this to check in, you know? And
yes, yeah, I see it. It's because there is a virtual appointment. It's like you said, I didn't follow along. I got it now. It's a virtual appointment, and the clinician's not going to say that. Their way of indicating I saw this patient is they'll say, right click, they arrived the patient, and now the next day or whenever, the same day or afternoon, whatever, scheduling clerk goes in, and then she completes the registration for that person, checking them in and all that kind of stuff. I thank you so much. Got it. Yeah.
And so then I can initiate the check-in process, right? Because I know from PowerChart, I can go through, right? I do my check-in, right? And then I can continue the full check-in process within the scheduling appointment book, or I can do it either way. Like I can do it through here, or I can go back through the other way, right? So that's what they're saying. And so then the checked-in status will be green, a lovely highlighted green, when I'm back on here. So they've got they've got a couple of different paths that they're suggesting our clinicians do. Honestly, Karen, it's going to be 100% up to the workflow of the unit clerk who's there. And I know it's one person because they just hired her to kind of figure out exactly how her day is going to go. And I think, and we know this, right? Come go live and everything. We've written all this out. We know this is going to be perfect. And then 3 days later, they're like, this isn't the right flow for us, right? Hopefully, as I say, what we're doing, what I'm showing is this is the buttons they click to do this action. Whether or not UBC Mood Disorders is going to continue doing all of these, I'm not sure, but I believe that they would, right? Because it's, you use the eye, you use this, and, and it's a future list. I think most of the clinics are using 2 or 3 or 4 lists, and these guys are not an exception to that. They're part of that.
So can I ask you, like, when you actually, I know you're giving us like the fast and dirty, right? That's great, because I know it's like a long all-day session, so I appreciate that. But when you guys are actually doing the workflows for the client, for the staff, do we then kind of show them the hierarching workflow? Like, okay, here's, a referral comes in, we take it off of the work queue manager.
They actually are playing with it. They play with it. So what I'm showing you right now is what they're doing. I'm standing behind them. They've got Citrix open. They've got the workbook beside them, and I'm telling them the steps to do, and they're following along and doing the scenarios.
But is the scenario then taking them through, like, okay, so yes, you take it off the PowerChart, and then you take it off the work queue, you put it on here, you create a referral encounter, and then the clinician is going to do their piece to review it, and they'll create an order, and then it does this, and then you are going to say it's going from one request list to another. Do you it's all in the workbook. So if I really took the time to read the workbook, it's all in there. It's all good.
And that's why, like, you can see here, we've got, UBC clerk external triage, right? External triage. So those are ours, right? Those are our students that we can play with. Right. Unfortunately, because this is the one that I've chosen to do, because it has the reoccurring appointments, it actually doesn't have in our work queue monitor. I logged off from my work queue monitor, sorry. It doesn't actually have mood disorders. So that's why I'm afraid of actually adding the referral, because it doesn't have my one that I'm in today. But every other one, I've been able to actually have the students go through, here's your document, I need you to add it, and continue on. And they've just continued that referral document all the way through. And so we do make them walk through every step with that patient, with that referral. Yes, they get to play quite a bit with it.
Okay.
Absolutely. Perfect. It's just right now, because this should be here you go, here's how you do it. And I want you to go in and play. And that's why everybody's going to have, I'm going to email everybody what students to use, what clinics to use, what usernames to use, so they can go in and they can start playing.
Gotcha. So I'm probably asking some dumb questions.
No, you're not. Not at all.
I'm not as familiar with this as these guys probably are. So sorry about that. Thank you.
It's fine. It's fine. So when you're doing, so this is actually one that this actually has recurring appointments. So it's pretty much the same thing. The only thing that we have to remember is that, and see, I've got too many things open. I think that's probably why I'm looping so bad. The only thing that we have to remember is that when you're doing a recurring appointment, you can add more than one patient at a time because you can do group appointments within this. But recurring appointments, you're just using the recurring appointment button, right? And so what you want to do is you actually would be putting into the work in progress area, you're clicking the recur button. And every time what you want to do is you're going to be adding a recurring pattern. So I'm just going to pull this over here to the workbook just because I know I can't do it because it won't let me. So this is activity 7.1, okay? So if we were over in our scheduling appointment book, right over here, here's our recurring button, okay? So this is what we're talking about. So this is going to be allowing me to book multiple appointments. So in here, I would search my person's name. I would search by PHN. I know I'm not going to come up with anybody, but again, what I would be doing is I would search for my patient. Here's my person search. I would find my person search. They would have a referral encounter. So I would already have an encounter down here like we saw the other time. I would look for my psychiatry encounter. I would select it. And then what I would do is I would hit my modify. Because I've already put them on a wait list in my clinic, I know I've got an encounter because I had the referral from the work queue monitor. Then I would come over here and I would hit modify. Then it would pop up my gray screens. I would continue through. And then what I would do is after all that's done, then once I would do that, right? So I've got my patient here and everything. Then I actually have my patient over in my work in progress. So you can see there that my patient brain is going to be booked for an appointment on Tuesday, April 11th. It's going to be in the mood disorder and he's going to be in the group session. So then I would hit my recurring button over here, right? And then we have our frequency screen that pops up. This is telling me how many appointments that this person needs, right? So then what I would do is I would select whether it was weekly. I can add as many search criteria as I needed to. Then I would tell them that I want 5 instances. The great thing about this is it should show me 5 appointments, right? So it should show me September 28th, October 5th, October 12th, October 19th, and October 26th, because this is a group session resource. So then what I would do is I would select my appointments, right? So I can either drag and drop or I can use the suggest button, right? So this is how ever you want to actually book the appointments for your people, right? So I want to book all 5 appointments. Unfortunately with this is you'll see here repeat steps 14 to 16 for the remaining appointments. I have to make sure that I add my patient to each one of those appointments. So I'm going to select the appointment and then what I'm going to do is I will go again. I can drag and drop them into all of them, or I'm going to use my suggest button. The appointments will appear. Then I'm going to double click them and I'm going to select them. So down here, what I've done is on the main screen, you can see that my patient has, that's the person that the appointment type, that they've actually got booked into all of the appointments. Then I'm going to hit my confirm button and then all my appointments appear. This is what the confirmation looks like. You can see here, over here is the details of the appointments that this person has been booked for. Okay. Then I'm going to hit OK. Then I can add my encounter selection and then I can add I can either do either way. I can add the encounter and then I can add the available conversations. And in this, it's still a pre-registration because my patient isn't there until the day of, right? So we have to remember that after we've done all of our work in progress, we've got all the appointments, we're still putting them in a pre-status. We're not putting them in a registration status. Registration can only be for today. A pre is for future appointments. Does that make sense on how to do the recurring? It's the same steps as booking an appointment. It's just using the recur button. The recur button pops up. says, what would you like? You're going to give it the criteria. You're going to select the criteria. You're going to select each appointment. You're going to add the patient to each appointment. So if there's 5, you're adding that patient 5 times. Then you're going to come through and you're going to complete all of the necessary fields. You're going to add the pre-reoccurring to the appointments, and then you're going to hit save. And then that's how you create the appointments. Does that make sense to everybody? That was very quick and very high level. Okay. We already talked about the automated appointment reminders. That's where I showed you that you would just go in and you would say, yes, that I would like to have an appointment. The phone number that is attached to the AAR, if there is no phone number for you to add in there, we say that there has to be one. It will default to the main phone number in their patient file. But we do ask that you add a phone number into that list because the clerks actually access that list from the AAR system, right? So they actually have a list that pops up. We'll say, what phone number do you want to call? Okay. They can, and the preferred method, they can either be texts, they can be emails, or they can be a phone number, but it can only be one of. It can't be a phone number and an email. It can only be either or. So that's something to remember. I don't have any patients. Is there any? I'm just trying to think. Where are we? So I've got PM office, printing reports. So we already went through the discerning portal. We've already done the clerk summary patient review. Okay, so in the power chart, going back over here, there's a couple of different things over here as well. So if I had a patient in here, right, I can actually look up all sorts of different information. One thing I do want to stress is, as a clerk, if it is not your role, do not look in different areas that you don't have access to, because it's a privacy and confidentiality thing. We don't want you guys looking up patient information if it's not something that is part of your role, right? We want to make sure that we, as clerks, are kind of protecting ourselves and not looking up a chart that we shouldn't be looking at. So also in PM office, which is over here, right? So here's coming over here is these are the different work lists, right? So most of the time what you'll be doing is you'll be looking at your deceased patients with active encounters. Let's just see if we've got anything in here. And again, you have to call up your clinic. Let's just see if Alzheimer's has anything in there. My thing. Okay, so if there was anything in here that I needed, so I'm going to close that, it would come up in here. So this is where they would come in and they would look at that every day, right? Our past due, they don't have one here. So there is also the past due arrival work list. So these are all your no-shows and everything. So what you would want to do as a clerk is you would want to come through and you would want to clean up any of your work lists that are your no-shows or anything like that. So as a clerk, this is going to be something that you're going to be doing on a regular basis. Okay. What else? We went over ambulatory. Actually, do you guys have any other questions? I think I kind of went through almost like the entire thing, but what you guys need to do is now you guys need to go through the scenarios and play with them, because I went over really quick and high level. You guys have any questions?
Hi, Kelly. I had to step away for another meeting for a little while, so not sure if it's been covered. I was looking at the workbook you attached, and I noticed there's a section on clerk workflows and power chart, which I just saw for the first time a couple of days ago in UBC cutover. Nice. And in that cutover, they're using it to enter patients' preferred pharmacy and lab details, address and phone number in the community. But is there anything else that clerks typically enter in that section?
Not really, no. It is preferred information. So the power chart isn't something that the clerks are going to be using to enter a lot of information. Depending on, like, this is the difference between a registration clerk and a unit clerk, right? And so I know we keep using the same word. Unit clerks have access that registration clerks do not, right? So when we were doing our workflow, we had unit clerks as well as registration clerks within the training. So I do know that the unit clerks, there are going to be some information that they will be doing because they can actually do orders and everything like that. Like there's a couple of different things that they can do where a registration clerk cannot in PowerChart. So a registration clerk, we won't be updating in PowerChart. We would, because it takes us over to PM conversation, right? So I can be in PowerChart, but it's actually taking me over to the module. It's taking me to the correct information. So yes, anything I update in here, as a clerk, I'll be 100% honest with you, I'm going to have to figure out my own flow. I, as a scheduling registration clerk, coming from that, I probably would never use PowerChart to update anything.
Yeah, that was my understanding as well. Yeah. Just seeing them enter pharmacy and lab info, it wasn't clinical information, but it did throw me off seeing a clerk enter anything in PowerChart.
That kind of throws me off too, but that to me sounds like it would be a unit clerk, not a registration clerk, because I don't know when a registration clerk would ever kind of be entering that information. We shouldn't be. That's not our role. But a unit clerk, absolutely, I could see doing something like that, right? Because I can't add an order, right? And I know the unit clerks can add, I mean, the only order they can actually add, they can add food, and they can add, I think they can do like CCI, or what are they called on this side, CCIs? I think they can do a CCI on this side, so they would be updating that. You can update address, you can absolutely update address, phone number, or anything like that. The workflow, I'm not 100% sure how that works, Abraham. Like, I don't know if I was in my specific clinic, I probably might use this. Coming from an inpatient ER thing, I don't know if the order entry goes down to the registration clinics and it becomes an ABU order, which is an order entry. Unfortunately, I apologize, I don't know how that workflow works.
That's all right. Thank you.
Yeah. Any other questions, guys? And I'm sorry it's very quick and high level. But as I say, I want you guys to go in with the workbook and play and break it and have fun with it and see how it works, because that's how our training normally works, right? You guys get to get in there and play with it. That's the best way to learn.
I had one other question if no one else does.
Yeah.
Again, in the workbook, I saw that there's the scheduling pivot report, which I've never used. When I did try to poke around in it, I got a little confused about how to actually get it to show me the info I wanted. Are you able to give a quick demo?
What one's that one? Sorry,
the scheduling pivot report.
And what one is that one? Just so I can be on the same thing, because I don't know much about the report, because we don't actually teach the report.
See, it's activity 12.1 of the workbook, scheduling
that's the discerning,
pivot.
The pivot report. Okay, so that's in the discerning reporting. Yep, I can show you. Okay. So what this one is this is actually for like all the no-shows or anything like that. This could be something that you would want to run. This might be something you don't want to run. It depends on the clinic. See, and I might not even have it here. There it is. So what I can do is, depending on, I mean, if I want to print it, if I want to put it to a file, I can save it, I can print it, I can create it to an Excel. I can, if I wanted to know how many no-shows I have in my clinic, I can select just the no-shows. I can select for a time period of October 1st till now. I shouldn't have any because nobody's been playing with this. I'm going to print a report. For my location, I need to select my location. Right, so then I'm going to select what I want. I can select multiple, I can select minimum, right? Double click. So if I wanted to look at seashells, let's look at seashells. And I want to look somewhere lower. So this is, I have to be specific on where I'm looking, but for right now, let's check seashell. We'll see what it's going to see, what it's going to give me. Visit modality. So I want to see if all of my, how many video others didn't show up or no shows, right? Were they part of a research study? It's not applicable. So what I want to know is I want to see how many people in Seashell that had virtual appointments between October 1st and 25th no showed, right? So then I hit OK. I don't know if it's going to give me anything because I'm not sure if there's anything underneath there. It cannot be. So there's probably nothing there. And because this is a test environment, it might not run properly, Abraham, that's why. But that's all I'm doing. So I can export this to an Excel. So this is something that a site may or may not want, a clinic may or may not want, to be able to figure out exactly who showed up, what kind of appointments are being used, and what should we be doing about it? Like if we have, 27 virtual appointments booked in a month and we had 20 of them no show, perhaps we don't offer virtual appointments anymore, that kind of thing. Does that make sense? And it's not going to let me run anything because there's nothing underneath there.
No worries. I think I'll just poke around and look at more in
And if you ever, and to make favorites, just put a star and then it comes up here on your favorites. Great question. Any other questions? Okay. Well, thanks everyone for joining me today. And what I will do is I will fire an email off to you guys with your usernames and the students you guys can use. This resets every night at midnight. So whatever you guys do today, it will be a blank slate tomorrow. So there's nothing that you guys can do that really is going to affect these fake student or fake patients in here. And as I say, as RSDQ, we want to be able to break it so we can fix it. So play with it as much as that you guys need to.
Kelly, can I just ask if you could maybe show us again just how to get into the test environment? Because I know some of the folks joined a little late. So
yeah, I will close everything off. Okay, so the best thing that's me and my son. So what you guys are going to do is you guys are going to come up here. You guys are actually going to go into the Citrix. And once you're in there first time, it should actually remember. And it is. And it's the same domain name for everybody. Okay. So what you guys are going to do is it is HTTPS and then PHSA, right? So once you've been in there once, it does remember you. So it's phsacd.centerworks.ca. You hit enter, and then it comes with your Citrix train and on. The username is the same. So it's the CST remote training. The username does not, it's not case sensitive. The password is. It's the same password for everybody. And it's TEACH@2023. The domain should just default. Fingers crossed it's going to let me in because it wasn't letting me in earlier. Make sure there's no spaces or anything in there. And then you hit log on. Yeah, see? It does work eventually for me.
Sorry, Kelly, could you repeat the password again?
I will send it to everybody in an email.
Oh, okay, okay.
Yeah, but it's teach, capital TEACH, and then @ 2023. Because I'm on a Fraser site, it doesn't always like me. It took me quite a bit to get in last time. Make sure I have the right password. Oh, that's why, because my cap locks are on. And then when you're in here, you're going to be going into the S domain, right? And so it says that when I saw that you'll be in the domain S, the S domain, you'll need to be in PM Office, scheduling appointment book, power chart, and the work queue monitor. So you're going to click this. So you can see here my work queue monitor, my PM Office, my power chart, and my scheduling appointment. If you open them all individually, you have to put that second username in each time. So if you go over to power chart and open it, it'll come up here as a download. Open the file. And then your username, I will send everybody usernames. And then the password is the same for everybody, and that I will also send in the email because the usernames are long. But it's info.2023. It's the same password for everybody. And then you open, and here's my power chart. So now, because I've already entered that password once, I can open my schedule appointment book. Here's my schedule appointment book, right? Now I'm going to go back over to my power chart, my PM Office. I can open it here as well. Maybe, might not let me. If not, then you just go back over here, open your work queue monitor. Work queue monitor isn't signed up. So then again, it comes up as a download. I'm going to put my username in. Going to hit OK. And it wasn't opening my power chart, my PM Office. So I'm going to come over here. I'm going to open it again. Power chart.
Kelly, Miss Danica,
there you
I
go.
have a question.
Yeah.
Would everyone have access to the train domains? Like, I know I had to request for access from mine.
So what I do is I actually ask for usernames for you guys. So yeah, so you guys have usernames from the 26th to the 31st. And I'm going to send them to you. So yes, we have to actually
perfect. Thank you.
Get access. That's that train info, the one that I copied in there. Yeah, we have to actually request those usernames.
Okay, thank you.
Yeah, and I've done that, and I will make sure that you guys all get one. And if you need it for longer, we just need to request longer. We just need to request new ones. And it's pretty much the same username every single solitary time. It's just that they reactivate and deactivate them. That's all it is. Anybody else have any questions? You're right, I did have the wrong thing. So there's UBC.
Kelly, I think we all already have access to the Y training domain through our regular Citrix portal, but will the same username for Cerner work in those domains as well?
No, these are specific for the S domain because this is where the fake patients are that they've created for us. So Citrix has us working in the S domain.
Gotcha.
Yeah, they could work, but when we request usernames, they tell us what domain they're for. And so these ones are for the S domain. Any other questions?
Yes, sorry, I just have a question. So you said that we can play today with this one and you're gonna restore at midnight. It happen every day, so in case that we need to do it other day, we can still play with that.
Yeah. Yeah.
Thank you.
You're welcome. Any other questions? Sarah, are you good?
I'm good for now. Yeah, thank you, Kelly, for going through this overview.
You're welcome. And as I say, guys, sorry if some of it's a little high level. I'm coming from the Fraser side, so I only learned Citrix in September, and I haven't been actually on it for a couple of weeks. So, and my pop-ups were not popping up properly, so that defeats me a little bit. So I apologize again.
Thank you so much. I really appreciated it.
My pleasure. And if there's any questions, and I am going to find out about that clinical thing. I know that one drops off the list, but I want to make sure. I want to understand that other piece, Karen, that we talked about earlier. So I am going to ask Cindy that one.
Thank you.
All right. And so I will follow up with an email to everybody with the students to use. It'll just correlate with your number. So if you're 1, use 1. If you're 2, use 2. Right. And then you guys can play as long as you need to. And if anybody needs access after the 31st, I can request the usernames for longer, guys. So that's not a problem. All right.
Do you guys did just asking the BAs, like, did you guys find that helpful? Did you feel like that gave you guys a little more understanding of the workflows and what they have to do, that kind of stuff?
Yeah, I found it really helpful. I just want to ask Kelly if after we play around with it, if we have any question, can we message you?
Sure, absolutely. I'm not on the Providence side on a regular basis, but I'm on the team, so use the Fraser Health one. But absolutely, absolutely, yeah. And if I don't have the answer, I will find out for you. I will get the answer, and I will find out. That's not a problem.
That's great. Thank you.
Yeah.
Yay, fantastic. Okay. Thanks, guys.
All right, well, thanks, everybody. Enjoy the rest of your afternoon.
You too. Bye.
Okay, thanks, guys.
Thank
Bye.
you. Thanks, Kelly.
Thank you.
Bye.
Thank you.